Joining us now is Dr. Robert Murphy, a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, doctor.
Good morning.
What do you expect after Lollapalooza, and how optimistic are you about enforcement of vaccination cards and testing evidence?
Well, I hope it works. This is an experiment we haven't tried before. It was tried in Europe, actually, about a month ago, and it didn't work. There were over 1,000 cases from that event, similar type music event. So, we'll see. But I mean, this is basically a setup for a super spreader event. This is the absolute wrong time to have this kind of event.
Now, would you go or allow your child to go if they were vaccinated?
If they were vaccinated, that would be their choice, of course. Obviously, anyone who's not vaccinated should not go to this. I mean, that's totally a given. I wouldn't go regardless. I'm vaccinated. Of course, I'm not really kind of my style. I'm a little bit too old for Lollapalooza, but it's just the timing, unfortunately, to see this great Chicago venue get hit by this pandemic like this.
I saw some government officials in with some southern states saying that kids are not at high risk and that masks can be a health detriment. Can you weigh in on that?
Yeah. First of all, there's absolutely no scientific evidence that masks are a detriment. This is a pandemic. What's the detriment? You have to weigh the benefits and the risks. There's really no risk for wearing a mask. And as far as kids not getting sick, look at the data from Arkansas. They have the highest hospitalization rate in children right now in their history. They have 24 kids in the hospital, 7 in the ICU, and 2 on ventilators. These are children. This is not the adults. The adults have increased 5-fold, by the way, also in Arkansas. It's the 3rd lowest vaccination state in the country. So, kids get sick. That's all there is to it.
What about these boosters for Pfizer, Moderna, Johnson & Johnson? Do we need them? Will we be getting them soon?
We're going to be probably having to get a booster soon. But right now, what they are pushing is they're looking at just one metric. They're looking at antibody titers. And they do go down with time. Now, this is true after many vaccines, but that doesn't mean you're still not protected. We're not seeing these vaccinated people in the hospital any more than we expect. So there's much more to the immune system than just this antibody test that's being done that does go down over time. But it's a harbinger for the fact that we are going to need a booster at some point.
All right. Some questions from viewers. The CDC just confirmed that vaccinated individuals who become infected with COVID have just as much viral load as the unvaccinated. So what's the point of being vaccinated?
Yeah, there's 2 things going on here. There's viral load and there's infection. The vaccines work very well in preventing infection, at least 90%. So, okay, the viral load is high in people who are vaccinated who get sick. Now, the thing is, that means that if a vaccinated person comes in contact with somebody, now they're going to have to get tested. So that's because of this high viral load business. But still, the rate of infection is 90% less.
All right, next question. If the public school system requires all students to have chickenpox, measles, and mumps vaccinations before entering school, why can't the public school require all students to be vaccinated for COVID over the age of 12?
Well, this is coming. I don't know when it's going to come, but this is the direction we're going. This person is absolutely right. We have mandated vaccines for a variety of diseases to protect children, and COVID is just another thing that's going to be added in there. We are expecting the group 5 to 11 years of age to have those results and EUA approval by the end of September of this year, so very soon. So you're going to see this coming.
All right. Well, if you didn't get your question answered by Dr. Murphy, he answers them bi-weekly on Northwestern University's Institute for Global Health Facebook page. You can also submit questions via email or go to our Morning News Facebook page, post one there. We'll talk to him again tomorrow. Thanks, Doctor.
Thanks, Doctor.
Good to see you again.
You
Hey,
too.
Morgan.